Today I want to take the time to thank the doctors and nurses in the hospital and offices, and I know how important their work is. So this is a special thanks from someone who's been involved. I don't think most people understand how difficult it is to work in the hospital or under the conditions that we have to now. I remember I went through SARS years ago, and it was very similar to this. We had to get fitted for N95 masks. And that's when I still had a big handlebar mustache which I waxed. And I was suddenly told, well, you have to shave that off because it won't fit your mask. So I shaved off the mustache. I got fitted for an N95. Most people don't realize outside of the professions that the N95 has several different sizes and that has to be specially made for you. I pulled out one recently, went to the grocery store, and I could barely breathe. And I remember how constrictive it was. But people are working in the hospital with those masks on, shields, hats, waterproof gowns that make you sweat like crazy and the sweat runs down your legs, under lights, double gloved. That's a horrible way to work. And to do a 12-hour shift, it's incredible. I know I couldn't do it anymore. The other ones I want to thank particularly are the porters and cleaners in the hospital. They were always my friend. Often after we had a tough night on labor and delivery and had to do a couple of emergency sections, we'd call the team together, but I also wanted to speak to the cleaners and the porters who were a special part of our team and often didn't get the recognition they deserved. I know the porters in the hospital ferry patients around and tell them jokes and reduce their stress, and they're basically psychologists helping people go through the hospital. The cleaners have been tremendously under-supported. They're the first line support workers for making that hospital safe. So thank you for all you do under very trying conditions, but you should be given thanks for every day you've done this.